Hello my dear doctors, welcome back. This is Dr. Azam here, your faculty of anatomy at PrepLadder. And today in this session we are going to integrate anatomy with radiology. So basically we are going to see a topic where we can integrate the anatomy with radiology. Why? Because you are able to see nowadays in your exams there is a lot of integration going on between different subjects. And of course anatomy and radiology will go hand in hand. Many a times the radiological image will be given to you, but basically the question is actually anatomy question. So today what I am going to do is, I am going to show you about the positioning of the heart, and we are going to compare the positioning of the heart inside of a body with the chest x-ray, and there we are going to see all the borders of the heart. So once you learn the anatomy of the positioning of the heart, of course the radiology is going to become easier for you. So first let's see how our heart is located inside of a body. Now my dear doctors, try to recall what will be the shape of the heart. What will be the shape of the heart? So please remember that our heart is actually cone shaped. Now if it is cone shaped, of course there will be the base, and then you have got the apex, and then there will be two sides. Absolutely fine. Our heart is like a cone shaped. But how it is exactly located inside of a body? Remember, this cone is actually fallen on one of its side. So make this cone fall down on one of its side here. And this is how exactly the heart is located inside of a body. So just remember one sentence here that will make your life easier. Our heart is like a fallen cone on one of its side. So this will be the apex here, and this will be the base here, and this will be the two sides here. So our heart is like a fallen cone on one of its side. So apex will be present over here, and the base of the heart is here. Please don't think that the base is present below here. The base of the heart will be present over here. Now keeping this in mind, let's look at this diagram here. Now in this diagram, the upper half of the body blood is collected by superior vena cava, and we can clearly see superior vena cava over here. From the lower half of the body, blood is collected by inferior vena cava, and it is present over here. And from superior vena cava and the inferior vena cava, the blood is coming into the right atrium here. Perfect. And from the right atrium, the blood is going into the right ventricle here. And where exactly is the left ventricle? It will be present behind the right ventricle. So therefore, this one here will be the left ventricle. Now once you are comfortable with all this over here, let's get back to our positioning of the heart. What is going to form the apex of the heart? Just look at this diagram and you can easily answer. Apex of the heart will be formed by left ventricle. And where exactly is the apex of the heart located? Remember, it will be present in left fifth intercostal space. Left fifth intercostal space. Now simultaneously, what is going to form the base of the heart? Remember, the base of the heart is formed by right atrium as well as the left atrium. Now here some of the students will be having a confusion. So we are able to see only and only the right atrium here. But remember, am I asking you only the border of the heart? No. I am not asking you the right border of the heart. I am asking you complete base of the heart. For example, our heart is like a fallen cone here. I am not asking you the border of the heart here. I am asking you complete base. So base is actually formed by right atrium in the front and the left atrium behind. Now sometimes in the exam they are giving both the options. For example, base of the heart is formed by, first option is given as right atrium, second option is given as left atrium. If both the options are given, then which one will be the best option to select? So remember, base of the heart is formed by right atrium. It is going to contribute 1/3, whereas left atrium is going to contribute 2/3 to the base. So it means that if both the options are given in the exam, then the better option will be the left atrium. So remember, base of the heart is formed by both right atrium as well as the left atrium. If both the options are given, then the best option will be the left atrium. So then what is going to form the inferior surface of the heart? The inferior surface of the heart is partly contributed by right atrium. Then you can clearly see it's partly contributed by right ventricle, as well as it is also partly contributed by the left ventricle. All the three of them are contributing to the inferior surface of the heart. So similarly, what about the lateral surface of the heart? Remember, the lateral surface of the heart is formed by left ventricle, but along with that, please observe very carefully here this ear-like projection over here. And that is the ear-like projection from left auricle from the left atrium, therefore it is also referred to as left auricle. I repeat again, from the left atrium we are having this ear-like projection, and this ear-like projection is referred to as left auricle. So left auricle as well as the left ventricle, together they are going to form the lateral surface of the heart. Then apart from this, the other structures you know very well. This one here will be the ascending aorta, then there will be arch of aorta which continues into the descending aorta, and of course this one here will be the pulmonary trunk dividing into the pulmonary arteries. Now once you are perfect with the apex, the base, the lateral surface, inferior surface, all this positioning of the heart, and now let us compare our anatomy with radiology. So for example, if this chest x-ray is given in your exams, then how to identify all the borders one by one? So try to recall from anatomy now. This one here will be the base of the heart, and we know very well the base of the heart will be formed by your right atrium as well as the left atrium, and in this diagram the one which is visible here, this border which is visible here, is actually the right atrium. Then followed by that, this one here is actually representing the ascending aorta. This is representing the ascending aorta, and that is going to continue above as superior vena cava. Perfect. Now similarly on the other side, you will be able to appreciate that the aorta is going to take a turn here, and that is going to represent the aortic knuckle. We'll call it as aortic knuckle. Followed by that, you will be able to appreciate the pulmonary artery. That one here will be the main pulmonary artery. Okay. And then the one which I told you, the ear-like projection over here, and that one will be referred to as the left atrial appendage. So this one here will be the left atrial appendage, and followed by the last and final one over here. Yes, the lateral surface is actually formed by what? It is formed by the left ventricle. So this one here, definitely it has to be the left ventricle. So in this manner here, my dear friends, I hope you are able to realize, once you learn anatomical position of the heart in the gross anatomical image over here, it's so easy to compare that with the radiological images. So nowadays in your exams, it is like trending fashion here, like they are giving the radiological image, but actually the question is from anatomy itself. So if you learn in this integrated manner, the things will become easier for you. I hope this topic is easy. Thank you. All the best.